Welcome, Dr. Scott Gray here, host of Top Minds, where we talk with the top minds in healthcare, life, and business, with past guests such as the founder of the Orlando Magic, Pat Williams, and many more, and how they're making a difference in the world today. I'm also the founder of over 10 healthcare clinics, Gray Marketing Enterprises, and a doctor training business to help docs grow their best practice in life. This episode is brought to you by gmedigital.com. That's Gray Marketing Enterprises. We completely help you run your healthcare business, making marketing easy so you can focus on providing the best healthcare possible. And if you've ever thought, how can I see more of the perfect patients who need our help, contact us today. You can email us at support@gmedigital.com or just go to gmedigital.com to see the services we provide. Today, we have Dr. Brandon Bupp with us today. He is husband to his wife, Amber, father of 2 kids, Bryson, who is 9, Mackenzie, who's 10, and another baby on the way in mid-April. So right now, outside the office, he spends a lot of time coaching his son's sports, watching his daughter's sports and golf and deer hunting, all these things when it's possible. His faith in Jesus is a big part of his life, as you'll notice when you talk to this guy, and same thing with me. And so he is the owner of Advanced Health and Wellness Center. He started that in 2007, graduated from Palmer Chiropractic School in 2005. He integrated his practice in 2010, bringing on a medical staff, which is now connected to another business of his, which is Advanced Performance Fitness. He's opened as a primary owner, and he's sold with other 4 physical medicine practices. Currently, they do corrective care, family care, subluxation-based chiropractic, along with functional medicine. And so they started in the regenerative medicine field in late 2016, early 2017. Their regenerative medicine program is quite comprehensive. That's what you're going to notice here today. They utilize different types of injections, PRP, umbilical allograft, but also incorporate, joint and spine biomechanics, physical rehab, laser, PEMF, all these different things, even nutritional coaching, vitamins and supplements. And so we're going to jump into that today and help you understand a little bit more. Dr. Bupp, welcome to the show. So glad and thankful that you took some time with us today.
Yeah, Scott, thanks for having me. I appreciate it.
My pleasure. And, with a lot of that intro, we both got into this about the same time with regenerative medicine and bringing on medical staff. And, the field has changed a lot in the last couple years. And I think today what we want to do is dive into that. And I also want to get into really what separates you from a lot of the other people out there doing these types of treatments. So first of all, share with me, how'd you get into regenerative medicine and what kind of drew you into this field?
Yeah, so we integrated our practice, like you said, in 2010. And I've been fortunate. My same medical doctor has been with me since 2010, overseeing, what we do in our practice. And my physician assistant has been with me for 6 or 7 years now too. And so anyway, we were doing the traditional physical medicine stuff. So meaning we were doing joint injections, trigger point injections, bracing, rehab, fairly extensive rehab with people and chiropractic. And we expanded and opened some other practices. And I think it was like 2015. It was like from 2014 to 2015, like overnight, insurance changed. I guess that was an Obamacare thing, but they got rid of some of the codes like that we were using. They reduced the payment on some of the codes by well over 50%. So something that was maybe $200 an injection went down to less than 100. And so we also were doing like Suparts, the different hyaluronic acid injections. Insurance was pretty good about covering them, and same thing with some of the durable medical equipment. And then they just started cutting things, and the injections. I mean, we were getting paid almost the same amount for the stuff that was in the injection that we were paying to buy it from the company. So it was like, and along those lines, my job was always to try to figure out how do we best help our patients? And we always wanted to do that. So we got into functional medicine. And around that same time, I started hearing people talking about stem cells. And I wasn't really interested for a while because we had people that were doing great and getting good results. At least, I thought they were. And I kept hearing, like, you got to check this out. You got to check this out. You got to check this out. And so I did. And I was like, man, they weren't kidding. Like, we weren't able to help those people. We were getting good results with what we were doing, and people that we could get to. It was sometimes short term, like you do the gel injections and then you got to do them again in 6 months or something like that. And it wasn't always complete, And then with regenerative medicine, we started doing these injections, and people are like, yeah, I wasn't able to work. I wasn't able to squat. And I remember, like, one of the very first guys we did, he wasn't working. He wasn't playing basketball. He wasn't squatting. We did his injections. And then, like, 3 months later, he came in. He was like, man, you guys should video this. And he was squatting. He was like, I'm back to playing basketball. I'm like, man, we didn't hear that with the things that we were using previously. Mm-hmm. So that's kind of how, and then we were like, okay, well, how can we continue to advance this?
Yeah, I love it. And, you mentioned stem cells, you've mentioned regenerative medicine. And, when we first started this, it was all about stem cells, and everyone's, advertising stem cells, talking about stem cells. How would you say that has changed as far as, how we look at this now and really what this treatment is that we're doing?
Well, so in our case, in your case, and in our case, the stem cell is just a component of it, right? I mean, even the injection is now only a component of it. So we're using umbilical cord allograft, which has a whole lot of other things in it inherently in that tissue. Growth factors, cytokines, anti-inflammatory properties, but it also is a cartilaginous substance. So it's got different proteoaminoglycans and collagen and hyaluronic acid and all these things that provide a cushion and support for the joint, along with the resources that the body actually uses to heal. And then it has high concentrations of mesenchymal stem cells. But now that's almost like, it's almost an afterthought. It's significant, obviously, but the fact is it's the tissue, right?
Right.
This is good for joints. And now you can see that the research is showing, well, umbilical allograft it's the best thing to use for a joint that's degenerative because of all the other characteristics of the tissue, and not simply that it's a stem cell thing. And so, yeah, man, that's been a big change.
Definitely. And I think, we've kind of gone down that same path as, we're always trying to stay up on what's the FDA saying, what are the medical boards saying, what do they really see this treatment as, and how do we do it the best? And you and I have both landed using the same product because, and I think you and I kind of research maybe more than most, as opposed to just listening to, a lot of people use stuff because a salesperson stops by their office or something, we really researched what was in there and wanted to make sure that we were doing it right. And so, but I want to get into your protocols a little bit because, a lot of people will do, just an injection and, like we don't have physical therapy in our office, but a lot of times we'll refer out. Will you talk about, really looking at this thing as a holistic treatment as opposed to some magical shot that's going to change everything?
Yeah, it kind of got sold that way for a while there, didn't it? Mm-hmm. Like you're going to put this stuff in your knee and then all of a sudden you're going to have like a new knee. And, it just that's not the case. The one thing that we always try to talk to people about is your body is doing the regeneration, period. So it's not the replication of stem cells that's giving you a new knee that's significant. It's the fact that those stem cells may be working cooperatively with your immune system, to repair damaged cartilage or to repair damaged tissue, or we've always believed in the infinite innate intelligence of the body, which is at work in this case. And so we're looking at the injection, and don't get me wrong, like I was just thinking about this the other day, talking with our staff. Still, we can't forget that we could have done all these other things before and people wouldn't be getting the results that they're getting without the actual injection. So that is a huge component with somebody that has severe degeneration. But we've also incorporated things like laser. So we use Arconia's laser. We also have a class 4 laser. And Arconia, like one of the lasers that we use, has FDA clearance, meaning it's the same as FDA being a drug being FDA approved. This is classified as a medical device, and it has clearance for treating back pain. It has clearance for treating joint pain. It has clearance for reducing inflammation. So the FDA have said you're allowed to say all of those things about this laser because we've shown and demonstrated that that's what it does, which is really cool, right? And so we've also incorporated pulse electromagnetic field, which has FDA clearances. It was developed and utilized by NASA, and it has FDA clearance from way back when, years ago, for healing of non-union fractures. So if it can stimulate bone healing, to the point where they go, yeah, you can call this a product, a device that heals non-union fractures. I mean, that's pretty good, right? So
absolutely, yeah.
If it can do that, then it's going to be able to help with regenerating cartilage. And they've been able to show that, and they've shown that, it increases vascularity of an area, microvascularity. And so we're utilizing those things. Sometimes, Scott, you've probably experienced this, where you have a person that's they got knee pain or they got shoulder pain, and they just have ropey, knotted up tendons and ligaments.
Yep.
Well, most practitioners are not injecting every one of those tendons and ligaments. You're getting and also getting into the joint. So you got to have something that can get blood flow and function back to the muscles, ligaments, and tendons. So we utilize chiropractors. There's a specific exercise and rehab program that makes a big difference. And then the other thing is, my wife is a nutritionist, so she's also here. And I mean, that's just about as powerful as anything. There's a study that we talk about in our lecture. If a person loses 1 pound of weight, it takes 4 pounds of stress off their knees. So wow. If a person can be eating right, reducing inflammation, and losing weight at the same time, they've just taken stress off their body and reduced inflammation. I mean, so we try to set this thing up, man, like we're stacking the deck so somebody can have the best possible results.
Yeah, I love it. And so let me ask you mentioned, a lot of these different treatments, the laser, the nutrition, and we were kind of talking a little bit before this about how the landscape has actually changed as far as, getting patients from other doctors and people around the area. How have you seen that change as far as, working with other medical professionals where you are?
Yeah. So, it was just something that I really, we were saying I need to dive into a lot more, because I have had several patients that have said, back surgery is really not a great idea. There was just a story. I don't know if you're in Florida, but on our news channel in Cleveland here, there was a story about a coach, high school coach, that had back surgery and ended up paralyzed. Wow. It was like a routine surgery. The studies show that it's the efficacy, it depends on the study that you read. I mean, but it's not something that has a huge efficacy rating. It's not like it's a 90% and 80%. Some people will put it under. The best I've seen is 50%. where people have been happy with the results of surgery. I've seen less than that too. We know it's not a long-term correction. So anyways, I have doctors that are saying that don't do back surgery. Like, you should do everything else that you can before you do back surgery. And we're in agreement with that, obviously. But also the results are really, 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 really good. And when we have people that aren't responding, we refer them to doctors that we know do a good job. But we're hearing things like that. I had another lady, she had 2 different doctors. Her pain management doctor said, hey, you really need to be doing chiropractic. Another lady was, it was a sports medicine doctor, and said, chiropractic has been shown to be the best thing for this problem. So that's been pretty cool. And like I said, I think it could be better, man. And really it's just a matter of, I think, probably talking to people and educating them about this, the situation. I think they probably want medical doctors want better answers for people. Mm-hmm. They just don't always know who it would be good to send their patients to.
Right. And it's nice seeing the tide turn a little bit and seeing, a little bit of a paradigm shift there. Because I've always been a believer in just, with both of us, integrating our practices. I think we see, it's not like, alternative medicine has all the answers or the medical field has all the answers. It's like, how do we work together? How do we do the best thing? And, the laser, the injections, the physical therapy, how does it all come together? How does that patient, how do you stack the deck for the patient to be able to get the best possible thing? So,
well, yeah, I mean, think about this. Like, I had a guy, we'll put his testimonial up probably on our Facebook page. It's at Advanced Health and Wellness Center Facebook page. He was on 3 different, like, serious pain medications. He was taking 9 gabapentin a day.
Wow.
Right. Basically that shuts down your immune system, right? Your brain, your thinking. And he's a great guy. And he said, I was like in a stupor all the time. And anyway, him being able to get off of those medications is a big deal. And we've talked about this, like, we want to be able to work cooperatively with their doctors, right? So we don't say, I don't think you say, we're going to manage your medications, but we do need to be able to have some conversation about it, because we know that guy has a better life now. And he was headed towards back surgery and staying on those medications and not working. He had a very, very powerful story. But the other side of that, Scott, is that sometimes this is not 100% treatment for everyone. It's not a magic bullet, and it is not that everybody should get this injection. And so guess what? Sometimes we got to refer them to people so they can have a medical evaluation. And so it's what you're saying is what we've tried to talk with people about. If we can help you without drugs and surgery, man, that's a much better situation for you. But there's a handful of people, there's a demographic of people, they might need drugs and surgery. And so how about we do what's in the best interest of the patient?
Yeah, absolutely. And I know that, this was even because of the opiate situation, it became such a big deal in Ohio. And when I was on the state, like the chiropractic association board, and on actually city council president in Marion, and a lot of stuff that was going on during that time was, hey, let's change the rules, right? And they literally went in, medical doctors, orthopedic surgeons, neurologists, chiros, everyone went in and said, hey, when someone has pain, what do we need to do? And they came out with, not drugs and surgery first, right? Physical therapy, chiropractic, massage.
Yeah, that was right here in Ohio.
Yeah, and that was like, 2-3 years ago. Now, it's not like they've enforced it yet, but they've started with the rules, and they said, okay, this is something we can start to follow. And I'm excited for the future to see where it goes. I personally feel like, 30 years from now, we're going to look back at how we treated pain and just look at it almost like we look at how they used to do like bloodletting, thinking of it like it's barbaric.
Yeah, I don't know if you've seen the Netflix thing, The Pharmacist. Yeah, so you should check that. That's a good one. Just talking about the opioid epidemic with OxyContin. And the FDA said that it was healthy, or not that it was healthy, that it was safe.
Mm-hmm.
That it was safe. And then they go, oh, crap, it's not safe. But it's still, people are still getting it. So just as far as but if you also look, like I said, there's things, chiropractic has been shown to be very effective. So I don't know if you got the Ohio State Chiropractic Association there was a bill that was passed. And I don't remember exactly what it was, Ohio government somewhere. It was talking about the elected official, I'll say, forget who it was saying how chiropractic has proven itself to be safe, effective, and a great option for people in pain. And it's widely underutilized for its value. And that was coming from the government. That was a representative on the medical directory board saying we need to get chiropractic more involved. And again, not just chiropractic, right? So it's also the same with the rehab, that's why there's people that we've taken care of in chiropractic that they've been my patients, and they've had certain issues where I wasn't able to help them as much. And we've done the umbilical allograft injections, like with SI joints or with the spine. And then they're pain free.
Right. Yep.
So the other thing we talk is, we do some marketing and things, and we always get insurance doesn't cover it, or we get, it's an injection. It's not regenerative medicine is not an injection for everybody. It is for some people, but there's more to it than an injection. Some people just, for us in our practice, the way we do it, some people would still benefit from chiropractic and decompression and laser. Mm-hmm. There's answers for everybody. So it's not just a matter of, this thing is just an injection or it's not an injection.
Absolutely. There's a qualification process. Once you find out what's really going on and what's causing the problem, that will determine, obviously what they need, and then pick the best thing, and whether that's us or someone else, figure out where they need to go. So now we talked about, like I just said, kind of like in 30 years, looking at the pain epidemic and all that kind of stuff, and opiates and whatnot. Where do you see, I don't know if you've thought about this, around the corner, regenerative medicine in 5 to 10 years? Because right now, the FDA is kind of figuring it out, where they want to take this and what they want to do with it. Pharmaceutical companies are doing research. Where do you see things going in 5 to 10 years, or even further down the line?
Yeah, I wish I knew because we know where it should go. The fact of the matter is, anything that we can do to get people off narcotics that is non-addictive, is safe, is effective, really ought to be better utilized, right? I don't see how you can ignore that. The public is not ignoring it. The public knows the dangers of it, because most people have been affected by someone addicted to pain medication. But here's the other thing, man. You got to get to the thing that's causing the problem, right? If you use this example, I use it. We don't need to go into it, but if you're just stopping the signaling that there's an issue, then the person will be in need of medications ongoing, addictive or not. They still need it because you never stop the problem. So I don't know, Scott. I do see, I had, we have people send us things, selling products all the time. And the reps are starting to say, the FDA is backing this research. or the FDA is in favor of, or one product was it was an amniotic tissue product, but the guy was saying, we had I think it was 90,000 injections, 70,000, 90,000 injections, no adverse reactions and no adverse issues, and it was shown to be more effective than saline, which is the test, and then hyaluronic acid injections. And so he's saying, like, it's likely they're pushing towards getting some FDA, whether that's FDA approval. I mean, but then where does that go? Because then it gets classified as a drug, right? So I'm not sure. I mean, like, PRP is effective. It's been used for a long time, and it still doesn't have. It has some, clearances. The problem is, man, with like the case studies, they go, well, it's cleared for shoulder problems.
Right. It's so specific.
Yeah.
One little area. Yeah.
Right. And if you're not using it for the shoulder, then it's not covered by insurance.
Right. And you can't make any claims for what it does or anything like that, right?
Yeah. So in many ways, it can be more restrictive. So, but I can't imagine that it can be ignored, and again, I think it's going to be driven by the public interest. The public is saying, we don't want to manage our pain anymore. I think that there's a lot of people that don't want that. I mean, I can't tell you how many patients I've had that they've had an orthopedic surgeon say, your only option is knee replacement, or your only option is whatever replacement. And they were like, nah. And they weren't even really close to that being their only option. I mean, we looked at their x-rays and like, these people have plenty of options. Mm-hmm. But you're out of options in terms of like cortisone or other surgeries.
Right. And that model with the tools, with their tool chest, right? What they have to do. Yeah.
Right. And then they do great. So again, I don't know how it can be, I don't know how it can be ignored, but I also don't know. What do you think about that?
I'm with you. Obviously we don't know. And because the FDA is, really working to see where they want to take this thing. And, I think that there's, products that we use that fall under a specific classification, that an allograft, or think of like when someone, gets a heart transplant or gets a liver transplant, they fall under a certain FDA rule that allows it to happen without it being a drug. And I think that, if the product that we use can stay under that, then that would be the best way, that we don't have to deal then with all the INDs, the investigational new drug, and then it's like just knee, right? Or just shoulder or just back or whatever it may be. So I know that there's going to be some that fall under that, and there will be some that go there, but I love the fact that there is at least a product right now that falls under, this allograft, or this tissue, just like the heart transplant and whatnot, that we can do those things and not have to worry about it. So again, we follow the FDA's guide and do what we can. And I agree with you. The public is saying this. I mean, that no one comes into the office like, hey, is there like 3 more drugs you could get me on? No one is saying that. It's right. How can I get off this one or these 2 or 3? And because I'm sick of doing this, it makes me, cloudy. I can't function. I become a zombie. All the different things they go through, and the real worry of addiction as well. So I think that they'll definitely keep, the public will push for more natural options, and we'll just kind of have to see where the government takes us in that, and we'll continue to follow along and do things the best way we can that fall within the guidelines of right. What they want us to do. So,
well, the questions that you always get are, does my insurance cover this?
Mm-hmm.
And why doesn't insurance cover it? And one thing that we want people to know is that's also a slippery slope that you Joe Public might not want people to go down, man, because I think the price goes way up in that case. And
Right.
I don't know. And I think that probably there's some dilution or a changing of products to some degree. I mean, you know what happens when it becomes a medication. The only way it can get approved, right, is if it's becomes a medication.
Right.
Well, right now it's not a medication, and we take very specific steps to make sure that we're communicating to patients and utilizing labs that are following the guidelines for it being a human cell and tissue product in that classification, like you talked about, because we want to be able to preserve the most effective treatment option for people.
Yep. Yep. And it's always a battle to be clear on, what we're using it for, obviously for cushion and support in the joint and everything. And people come to us and say, hey, can you cure this? Can you fix this? And we don't cure anything. We don't treat anything.
Right.
It's really to cushion and support the joint so it can heal and do what it needs to do. And like you talked about, there's a lot of great stuff in the tissue, but that's how we have to use it under the guidelines that we have. And the great thing is just seeing the results, right? The great thing is just seeing, like you said, the patients that I don't know about you, but as trained as a chiropractor, it was hard to think like, well, my adjusting didn't work, but this injection is going to work. That was hard to swallow,
Yeah.
But once you start seeing the results, you just, you can't fight it. And you realize like, okay, that's where you give that up, the part of your ego or your paradigm or whatever, to say, okay, this is what's best for the patient because they're getting better, right? And I have to be okay with the fact that something else worked other than, the thing that I thought was the best thing since sliced bread. And I think what we're finding out is it's all piece to the puzzle.
Yes.
And you have to find the right pieces to get the whole picture for each patient. And that puzzle's totally different with every patient.
Well, I love chiropractic. Love it. I love the philosophy. I mean, it's ingrained in my family and in my brain. And I hear people like in the periphery, like, why are chiropractors getting out into these other things? Why are they not just doing adjustments? And then I'm like, I look at how important the chiropractic philosophy is to me. But I also know that I want people to function at their best with healthy treatment options, period. So there's things that like just the chiropractic adjustment is not fixing on its own. And a severely degenerative joint is one of those. I mean, and that's the fact. So why not use these things that are healthy, are still promoting a healthy, the biggest thing that we talk with people about is if you're not exercising, if you're not doing something for your emotional and mental state, if you're eating crappy food, I don't know that this procedure's going to help you, because we are in the business of getting a body to work better. And you've got to do a bunch of things. Sorry about the fact of the matter, but you've got to do a bunch of things in order for that to occur.
And it's helping people understand that it's a partnership, right? Yeah. It's not, I'm going to fix everything with this or that, but this is a partnership. We're going to work together. And if we, if we're honest with each other, if we each do our part, amazing things can happen. So, I love it. I know you need to go soon, but I appreciate you coming on, Dr. Bupp. If people want to learn more about your practice, what you do, how can they contact you? Where should they go to find out more about you?
Yeah, so our practice website is adv-health.com. And you can always call our office. Our office phone number is 330-336-9500. And we have a fairly active Facebook page. You know, some people will ask us, you know, does this work? And we have a lot of videos and testimonials, just interviews from people that have done it, you know, so you can actually see straight from the patient. And that's Advanced Health and Wellness Center. We're in Wadsworth, Ohio. And you can go on there and look and see kind of different stories and stuff. You know, look at our reviews. And you'll be able to kind of decide for yourself. But definitely give you some more information.
Awesome. Thank you, Dr. Bupp. Appreciate your time. Appreciate all you're doing to, you know, I feel like, you know, we're all kind of like pioneers in this thing. So thanks for doing everything you do, even if it ends up with a couple arrows in the back while you're, you know, trudging forward to make healthcare better for everyone. But appreciate it. Go to their website, go to their Facebook page, learn more about what they're doing, see the difference they're making in people's lives. And if you need anything, reach out. They're a great team. He's a great guy. I've known him for a long time. So thanks again, Dr. Bupp. We'll talk soon, man.
Thanks, Scott.